All right, let's do this thing. Well, welcome everybody, and thank you for joining us today for our live webinar. I am Jennifer Zalkin, the Director of the National Cannabis Risk Management Association. And for those of you who might be less familiar with who we are and what we do, the NCRMA is a trade association that was established to provide cannabis business owners, operators, entrepreneurs, and dreamers with the tools necessary to operate successfully and sustainably. Our offerings are designed to equip businesses all along the vertical with the tools, knowledge, and support required to build and grow profitable business models within this uniquely complex industry. Today, we're here to discuss the recent launch of our cannabis health insurance program, Health ReLeaf by NCRMA. Established in collaboration with NCRMA service partner, My Benefit Advisor, Health ReLeaf takes the association's mission of making members better through education, support, and expertise to new heights. The program was built to ensure that cannabis companies and their employees have control over their health insurance plans, allowing for better protection from health insurance risks and providing significant cost savings. Joining me from Wallingford, Pennsylvania for an in-depth discussion and open Q&A on Health ReLeaf is Brian McLaughlin, market leader for the employee benefits sector of My Benefit Advisor. Brian, how are you today?
I'm doing great. Thanks for having me. Really excited about having a discussion today to highlight the benefits of ReLeaf and how we can help so many of the members. So thanks for having me.
And thank you for joining us. First, before we dive in, I am going to share a little bit about you to our viewers. Brian has been in the insurance industry for 22 years and has been working with My Benefit Advisor for 19. In his role, he manages a team of benefits consultants who assist employers with health insurance and other employee benefits. He has spoken for many chambers of commerce and professional associations across the country. Over the course of the NCRMA's service partnership with My Benefit Advisor, Brian has surpassed the role of liaison to become a key collaborator on the ideation, build out, and execution of Health ReLeaf, and has spent the last year working closely with us to achieve our shared goal of forging an improved health insurance offering that gives cannabis businesses full control. Brian, why don't you start by sharing with us why establishing this program with the NCRMA was so important to you?
So, first of all, the cannabis industry is something that we see as a huge growth opportunity moving forward. And as I know, I don't need to explain to anyone on this call. Second, whenever we look at building programs for associations and kind of helping members, to us, we really are trying to find people that have a shared mission. And in conversations with the NCRMA, we realized that we were really on the same page of being able to deliver really unique offerings to the members, right? And that we had a structure of risk management, and we had a culture of risk management that people have already bought into with the NCRMA. And if we could just take that same philosophy and apply it to healthcare, that, by utilizing that, we would really be able to provide unique benefits, cost savings, and a really dramatically different experience for members. So the more the conversation went along, the more it just seemed like a perfect fit for us to put something together that really doesn't exist today, in the cannabis industry, and really, quite frankly, across most industries.
Yeah, and that's kind of a great segue into my first question. Healthcare costs and health insurance premiums have been spiraling out of control for quite a while now. And over the past decades, premiums and deductibles have risen faster than workers' wages, which means that employees are paying more for less. How does Health ReLeaf work to get those costs under control?
Yeah, that's really, when we looked at the program, as you said, there's two big components that we're trying to do to focus on, right? Because employer costs have gone up, but what most people don't realize is that employee costs have just gone through the roof, right? So, employers are doing everything they can to offer coverage, and then employees on top of that can barely afford it if they get sick. And so what the ReLeaf program is really built to do is attack employer costs in the big components. And we'll get into some more specifics as we go through by breaking it into a lot of different pieces and finding best in class for all of the pieces of the health insurance program. And then second, focusing the benefits on the employees on really making sure that there's access to care, right? We want to make sure that people are getting their preventative services. We want to make sure that they're taking their medications, that are prescribed. We want to make sure that they're utilizing the care that they need. And there's ways to control costs in the long run without getting in the way between the participant and their doctors. And that's the most important thing about the program, is really trying to make sure that we can build a plan that fits for everybody. And most importantly, if we keep the focus on where I think it should be, is making sure that the employees are getting access to the care that they deserve. And that if we can do that, they'll stay with our employer groups longer. They'll be, more efficient in the time that they're there, because they won't have to worry about healthcare, as one of the things they think about every day.
Absolutely. And that's really one of the, in the forefront, one of the reasons why this was such an important thing for us to build for our members, because employee turnover is one of the highest risks that can, happen within your business. And so offering something like this will make your employees feel appreciated, feel safe, and have less of a reason to seek elsewhere, where many other businesses within the industry and even outside of the industry do not offer their employees health benefits unless they've, been there for X amount of time, or, are on like the management team. But this is something that is really offered across the board. And so from the employee perspective, what kind of doctor and hospital access will they have through Health ReLeaf?
Yeah, so, as I kind of briefly mentioned, one of the nice things about this program is that although it's a consolidation of bringing a lot of different groups together, we can have very customized approach to each individual employer. And so what that means is that we're going to do an evaluation as a part of our process, to make sure that the network that's being offered is the right fit for that particular employer. Most of the business will end up in one of kind of two different networks, which are both national players. So Cigna or Aetna. And when we're talking about those carriers, we're only talking about utilizing the groundwork that they've done to go out and contract with doctors and contract with hospitals, so that we can kind of bring the cost down for the employee when they have those services, and the employer when they have those services. So, employees will have access to two of the largest networks that are out there. And, when we look at it, we see that in those two carriers, we're able to give the best or the second best network in any of the markets that we would be looking in. And that was really important for us, because again, you can build it what you want, but if the employees can't go, or more importantly, can't take their kids and their families to the doctors that they want to see, then, they're not going to seek the care that they really need.
Yeah, and I think that's important to note, because, as somebody hearing this for the first time and hearing that, you said Cigna and Aetna.
Yep.
Those are carriers that, we've all heard of and are familiar to us. And oftentimes in the cannabis industry, because we struggle to get access to, banks and other support from established organizations. It's really nice to hear that the caliber and of the program and of the carrier itself is not one that's, just getting jump started in cannabis as well. It's an established one. It's a legitimate one, and it's, or among others.
Yep.
So, and I know many of the questions might overlap with some of your responses, and that's okay. But so how do Health ReLeaf's cannabis community plans differ from other plans that are available in legal cannabis?
Yeah, so great question. So, the first thing that the differentiation comes in, and I think this really is core to the mission of the NCRMA and the understanding of, what we're trying to accomplish going forward, which is this is not meant to be, a 6-month fix or a 12-month fix. We're really trying to build long-term sustainability of the program, understand the employees' needs as we're going forward, and make sure that we design something that's going to work for both the employer and the employee. And so that all starts with our upfront risk assessment, right? So it's kind of twofold. It's a conversation from an employer's perspective of what really are you trying to accomplish? What are your needs moving forward? And is this the right fit for your organization, right? And if that's the case, then it's a deeper dive in a very secure and private way of understanding the risk of the employees. So it was very important for us to make sure that, we understood the risk of the employee so that we can provide the most competitive environment and provide the plan that's going to really fit for the employer. And as I had mentioned in another conversation, this is not information that I access, that the employer has access to. It's strictly from an underwriting basis. What it does is allow us to really dial in the pricing so that we can, at the end of the day, we want to make sure that it's a good fit for the employee, but we want to make it cost effective for the employer, right? You can build the greatest plan for employees ever, but if you're going to charge too much money, employers won't be able to fit it into their budget. So what's really different is that by taking that risk management approach right off the top, it allows us to build a much more sustainable program in the long run. The second thing it allows us to do is again, really dial in so that we make sure that the groups that are coming in, we can provide those first dollar preventative care and those types of coverages so that the employees can get access to the care. So I think that's really the biggest differentiator, is it just a different approach. Behind the scenes, the other thing that's a big differentiator is, as I kind of mentioned in the beginning, is that we're breaking the components of insurance into a lot of different pieces, right? So instead of just going to Aetna and taking everything good and bad that goes along with Aetna, right? We're going to say Aetna and or Cigna for the network, right? But we're looking at a completely different prescription drug vendor. One of the things that, if you've seen in the industry, like there's a lot of fat built into prescription drugs, an enormous amount, right? It's where a lot of costs are going up. When I started in this industry 19 years ago, if I would go into an employer and 15 or 20% of their Medicaid or of their cost were on medications, like that was high. Now it averages about a third, right? So if a third of the costs are in prescription drugs, it's not a coincidence that one of the largest prescription drug providers, being CVS, right, buys one of the largest insurance companies, being Aetna, right? So there's a lot of profit in there, and so part of the Health ReLeaf program is we can look at different vendors, and this is not something the employer needs to get involved in, that we do on their behalf, but bring in and separate out that prescription drug vendor, right, to drive lower costs, to drive lower utilization, while again providing the employees easier access to the medications that they need. And so that's the other part that's pretty significantly different about this than a lot of other programs, is that by breaking up those components and shopping them out for the best costs and holding all those groups accountable, we can deliver the lowest and net cost to our employers.
Amazing. And just, to touch upon the risk assessment, that is, anyone that follows us or knows that is what we firmly believe is the key to, understanding what your risks are, identifying them, and really making the most sustainable and smart business decisions. So I think that's another area that we just naturally aligned on, is that we both of our organizations firmly believe in the power of the risk assessment.
Yeah. And actually, one thing I just want to expand on that risk assessment. It's a process that we'll go through, but we also made it as efficient as possible. So, it's an online questionnaire. It's very easy to deliver to employees. It's collected directly through the system. The employer doesn't need to get involved. It's HIPAA secure. everything is kind of protected from a privacy perspective. So we're able to do this in not an onerous way. Again, we always have to balance out, making sure that there's efficiency. The clients that we deal with, don't want to be in the healthcare business and don't want to spend hours of their time building this all out. So we needed to make it as efficient as process. And that risk assessment is actually a very smooth process that can be done with pretty minimal lift on the employer side.
And I know that is very valuable, because I'm sure any business owner or anyone that's in the power of making this decision, the thought of kind of like changing over and starting new or might be very cumbersome, especially on top of the day-to-day functions that they are managing. So that is certainly a benefit. But can you tell us what requirements a business must meet to access this program besides being a licensed cannabis business within the US?
Yep. So in order to access the coverage, as said, it's a licensed cannabis business in the US. In order to participate, be a member of the NCRMA. And, from there, it's really, the biggest requirement is a commitment to that risk management, right? So to go through the process up front. And then one of the things that we haven't really talked about is a commitment to spending time with us, not a lot of time, but incremental time over the years as we dial in the benefits for your employees, right? So one of the advantages that we haven't quite talked about that is on the back end of this program, we get a lot of data. Again, it's de-identified, so we don't get personal data about any one person, but we get high-level data about what an organization's spending is like and where we can, in many times increase benefits, right, for the better performance of the plan. And so, in order to qualify for the program, that has to be something that you're going to spend time. This is not a one-time and forget it. But what we can tell you is that the companies in similar situations, not necessarily in the same industry, but in other industries that have made that commitment, have seen their medical trends significantly lower than the marketplace, right? One of the things that we think that this is the right time to get into this particular type of program. You had mentioned in kind of your earlier question about, trends and medical trends going up. One of the, I guess, strange, I can't say strange benefits of COVID, but one of the things that happened with COVID is that medical trends were in the 12 to 14% range, right? Going into 2018, 2019, right? And then into 20, and actually flattened out for a couple of years here now, right? Due to the fact that there were a lot of, routine procedures that just got pushed off, right? There were a lot of things that people should have done that they didn't because they didn't want to be in a hospital for obvious reasons, right? That once we kind of, as we're getting back to normal, medical trends are going to go back to where they were, plus all that pent up demand for 2 years, right? Like all those things that didn't get taken care of for 2 years are going to have to be treated at some point in time. And so for employers, it's not meant to be a scare tactic, but you really need to understand your risk and be in a position to make sure you can manage it moving forward. And that's why we think this is such an important thing to do now in 2022, going into 23, going into 24, because the expectation is what we saw in 18 and 19, we're coming right back there. I really, and you can, and I think in any research you would see around, there is a expectation that pricing is going to significantly increase over the next couple of years in healthcare. And so having data, being able to take these components out will let you take control of your plan. The last qualification, and this is something that we're working on, and I think, it's one that makes us different than any of the other people that are out there, and then we'll get even better, is that as of this second, we can still do a lot of the risk assessment and help anybody in the cannabis industry, but the Health ReLeaf specific program does need 25 enrollees or above. My expectation is as we start to build out that within the next 6 months, I can probably take that number down to 10 employees, which is really going to, expand to almost all of the membership. That being said, for most other people that are selling even slightly similar programs, their bottom number that they would typically go to is 50 employees and maybe even 100, right? So this is really a program, and it was very important to us. We would have loved to come out doing it 10 plus, right? But due to some issues, we weren't able to get that low right yet, but we are going to bring it down as soon as possible. Doesn't mean if you're 20 employees that we shouldn't have a conversation, right, to talk to you about where we're seeing different things and how we can maybe fit you into some of the other programs. But for the relief program itself, it's 25 employees.
Got it, and good to know. So it's no secret that cannabis businesses are complex business models, and due to their lack of clear industry standards and the ever-changing regulations that differ from state to state. How does the Health ReLeaf team work to tailor to the individual needs of each business, regardless of where they're located? And how involved are they? I mean, you mentioned like it's years or many years of a process, but how involved are they in supporting through, something that might not, a business owner might not already be getting support from?
Yeah, no, it's a great question. So, there's advantages just to the structure, and then there's advantages to the service model, and I'll talk about both things, right? So the nice thing about the consortium, right? So essentially what Health ReLeaf is that behind the scenes, we're basically sharing risk amongst a bunch of different companies. And to start off, it's cannabis companies, and then even companies outside of cannabis for the risk, right? And so as we can grow that, then we can just parse it off to just cannabis companies. The one advantage that you have is because of the way that the structure is, it's actually built on a federal basis. So some of the issues that you may have at a statewide basis in certain states don't really apply, because the rules and regulations, some of them, move more to a federal basis and allow us to be able to better design the program. It also means that we can get out of, and without getting overly technical, out of some of the ACA regulations. So not all of them, but we don't have to have age bandit rates, right? We don't have to have a gold and a platinum and a silver plan, right? Like we can have a little bit more flexibility on the design. So, that's one of the things that just from a structural perspective, it makes it easier to meet individual needs, because we don't have to jump through as many hoops at a state level. On the second side, one of the things that, really comes, and this is the combination of my organization at My Benefit Advisor, of the consortium, and of the NCRMA, is a real approach to long-term planning, right? So part of our account management approach is to make sure that once we do the initial assessment, that we have that conversation continuously ongoing with our employers, right? So there's proactive conversation happening throughout the year. We don't want you to think about health insurance 365 days a year. That's what you hire us to do. But I can guarantee you that if we talk in small increments every 3 months about where your business is going, what's happening in the industry, that when those big milestones come of your renewals each year, that it's just part of the process, right? We don't get surprised by things. We don't get surprised as your service provider, because all of a sudden you added 75 employees, right? In 2 new states, and you don't get surprised by an increase or, something changing that you didn't know. And so, the commitment from a time is more of a philosophical one, to say, listen, you can't just focus, it's not like other insurances where it's like my property insurance is coming up. I'm going to do it on December 15th and I'm going to put it away until 90 days next year, right? With health insurance, it's how am I, and you had mentioned this in an earlier question, it's not just how are you focusing on the health insurance itself, but what are you doing for your employees? How are they experiencing it? And how are we making this a better package so that you can attract and retain employees, right? And if something's not right, how do we correct course? So how do we get in front of those things? And so it's the commitment to spending, an hour a quarter, right, with us and with our team to talk about some of those things so that we can get ahead of it. And so that we can so that when it comes to renewal time, we're not asking you to spend 6 hours, right? We're not asking to take over your entire month. It's just a part of the planning process. And we move forward and execute on the plans we've been talking about all year.
So on the topic of time, how long does it take from the first conversation to program rollout?
Yeah. So, we can be anywhere from 45 to 90 days, right? And just to kind of back into that, whenever you're going to deal with a health insurance program, you want the employee's decisions to be done about 15 days, before the effective date, so that they're in the system, cards are done, anymore, their cards are on their smartphones, so we can get it down to 10 to 15 days, but we still want to do it there. We want to do a good job communicating it to your employees, right? And we want to give them a chance to make decisions that are right for their families. So you kind of back in, and we got another 10 to 15 days for communication and open enrollment. One of the things that we're going to do on behalf is that it's the evaluation up front, but then it's also our job to explain to employees, here's what the benefits are, here's how you use them, here's your choices, and how you can make the most out of this overall plan. And then here's the service model for if anything ever goes wrong, here's where we are to help support you, employee, in that process. Backing up even further, then the underwriting process typically takes, between the risk assessment up front, final pricing and things like that, we can get it down to 50 days, but that's typically more like a 30-day process, right? So, it's certainly, again, 45 could take up to 90. What I will say though, one thing I want to be careful is as far as the conversation, as far as people when they're thinking about it. This is not something that you should wait until your renewal comes up. Like if you have an existing plan, this is not something you should wait until then to have the first conversation, right? Like we can do it in that timeline, but why jam it in, right? You got enough things coming at you at one point in time and trying to evaluate enough processes, like get started as soon as possible. The other thing is that you also don't have to wait until your renewal. So say you're on a plan that was what you could find at that point in time, and it's not really working for you or your company, right? The way I always say it is that a health insurance carrier gives you a price for 12 months and you renew for them every 30 days when you send them a check, right? So if you're a January renewal and it's not working for you, and this seems like a better fit, you can move in June or July you can move anytime you want. There's considerations about deductibles and things like that, and we deal with those issues all the time. But, don't wait to have a conversation, because as much as we can do it in 45 days, it's a dramatically better experience when we take 60, or when we, are able to make sure we answer all of the questions before we move forward at implementing the program.
And that very much aligns with our, entire, everything that when we support businesses, the way that we support is don't wait until you need something to be proactive. And the best way to be proactive is to do a risk assessment. Because there are the things that you see, there are the things that you don't, there are the things that you could better understand. And then it allows you to make better, smarter, more sustainable decisions. And so I do kind of want to go back into the risk assessment once more. You slightly touched upon some of the information and outcomes that come from that risk assessment. What else is the risk assessment identifying for the businesses?
Yeah, so there's a couple different components. So I talked about the upfront risk assessment, and that's more at the employer base, right? And a lot of that really comes down to a significant conversation about attracting and retaining employees, right? And where are the gaps in your program, right? So although Relief is primarily focused on maintaining and controlling health insurance, because it's the biggest dollar amount, the risk assessment's also about, trying to manage, that employee cost of employee replacement, right? You'll hear different statistics right now, but it can cost anywhere from 50% to 75% of an employee's salary every time you have to replace one, right? And that has to do with what it costs you to recruit, what it costs you in lost production, quite frankly, now what it costs you in having to pay them more than you did the person that just left, right? And so, what can we do to kind of make sure that you are putting the right portfolio together to really meet the needs of the employer. So is it health insurance? Is it dental? Is it vision? Is it life? Is it disability? Right? So talking about that full package, how to design the program, how to do contributions, how to compare against other people in the industry. So a lot of that assessment is around just general conversation about the employer. Mm-hmm. On the medical side, it's also what we're then looking into is where are there opportunities that our program is specifically going to be able to attack costs, right? And so I give an example, and a lot of times it comes back to prescription drugs, right? Because it's like, if you have an infected appendix that has to come out, you have to come out, right? Like it sort of is what it is. Those things just happen. You're gonna have a baby, and then, and maybe there's some maternity things you can do from a wellness perspective, but like that's just going to happen, right? But when it comes to certain prescription drugs, when it comes to certain other things, there are ways to get more cost-effective, programs. And so, like one example we used is that we had an employer, and I won't name the medication, but essentially the medication was like $140,000 a year, right, for the medication. And through the partners that we're using here for Health ReLeaf, we're able to see, and it's a pretty creative program, but that we're able to go directly to the manufacturer. Because of the income level of the employee, we're able to get a subsidy for that. And we were able to take the cost of that medication from $140,000 down to $24,000, right? So for a small employer, for a 50, 60, 70 life employer, like $140,000 medication, listen, I know you're not paying, if you're paying a fully insured premium, you don't realize it, but it's still working its way back into your pricing, right? And so think of how taking $100,000 in cost in one incident really has a long-term effect on being able to drive down overall costs as far as the program is concerned. So those are some of the other things that is a part of that process we're starting to identify to really attack. And again, I hopefully it comes across in the answers. We don't attack it by putting up barriers to entry to the employees to get the coverage that they need, to get access to the medications that they want, to get access to the care that they want. It's not what we're trying to do. And again, in most of the times, a lot of the programs are all about making sure our asthmatics, our diabetics are taking their medicine, right? If people don't fill them, it's going out and making sure they fill those medications, right? Making sure they're doing things to, make sure that they stay healthy. But where we can attack cost, that's really where the program shines the most, is by going after the cost as opposed to the access to care.
Well, on the topic of cost, is there like a percent or savings that businesses that do join can expect or propose, or like a
Yeah, it's a great question, right? Because it does at the end of the day all come down to cost. And so, as we said, there's some qualification, right? If you had to fit the right mix and you're the right employer. So we see people that qualify for the program when we kind of go through everything. The typical savings is somewhere in the area between 10 and 15%. We've seen people make the move for 0% savings, guaranteed, but because of the data, because of other things, they've still decided it's the right solution. And we've seen people save 30%. Right? So it's varying degrees. The other part of the cost, though, that really I think is the more important one is that we see medical trends on the consortium model versus kind of the traditional model, anywhere from 5 to 7% less, right? And so when you take that out and kind of compound that, right, like the savings year over year get really dramatic. And so if you can take just 5 or 7% out of the cost year over year, when we get 5-6 years down the road, now you're starting to see savings 30% over had you not done nothing, had you done zero, right? Mm-hmm. So that's kind of the expectation that we would see employers, want to see from a savings perspective. It's all about, it's about two things. It's about risk management. It's about control. Right? It's about attacking it for your particular group. That's what we're offering through the Health ReLeaf program.
Awesome. So we're going to do one last question before we open up the floor to our viewers and attendees to ask Brian their questions. So we'll ask this last one, and you guys start thinking about what you'd like to know from Brian. But we've covered cost savings, we've covered client control, we've covered the employee benefits. Are there any other program benefits and perks that we have not discussed?
Yeah. So one of the nice things about kind of compartmentalizing the benefits is that we're able to add additional benefits for our employees, and we'll continue to do that as the program evolves. So, one of the things is that we offer telemedicine, in the program, which isn't standard in all benefits at this point in time. If you're not familiar with that, it's basically the ability to, interact with the doctor right over your smartphone. You can even get, you need a Z-Pack because you have the flu, Tamiflu, or you need a Z-Pack, you need an antibiotic, right? You can handle that right through, the phone. There's also pretty significant wellness programs, so access to discounts for, alternative care. So could be massage therapy, could be acupuncture, could be things like that, right? Like, so opening up some of those alternative medicines and being able to give access. They still might not be covered at a doctor copay, but other ways that we can provide discounts to them. And then from an employer perspective, there's discounts on some of the other ancillary benefits. So the dental benefits, the vision benefits, the life and the disability. One of the things as we were kind of building out this program, although we focused a lot on the medical side, the other thing that we're really focusing a lot on is that, the cannabis industry is significantly limited in access to ancillary coverages. And what I mean, again, group life insurance, group disability insurance, a non-cannabis industry client, I have sometimes 15 or 20 different carriers. On the cannabis side, I'm down to 2 or 3, right? And so, the program is all about building more capacity for those products. And so, due to our size and scope, we were able to even, open up one other market in that space. And we hope to continue to offer, additional markets. And we already have a couple of them interested as this program grows to be able to offer some unique things within the industry. So, there's a lot of things that as we combine together as an industry, as an organization under the NCRMA, that this is going to evolve to continually be able to, add additional benefits to what's going on. And the one thing I can just, again, say we have a focus on, it's always both components, right? It's a focus on trying to drive better costs and better results for employers, but then also make sure that the package that's put together is appealing to employees so that, employees, A, don't have to think about that while they're at work. They know they have good coverage, and B, that you can be the most attractive employer and steal people from other industries, steal people from non-participating cannabis farm locations.
Absolutely.
Right? So that's really what we're trying to accomplish.
I'll also add as a benefit is both the client or the customer, the members access to the NCRMA because, and yours and Health ReLeaf and my benefit advisor. So as my benefit advisor is working to improve what they can offer cannabis businesses, you're working with us, an organization that has a network of experts and service providers and people that are actively dialed into improving, the industry's ability to grow and just the ease of operations, so the day-to-day. So as you continue to build it, you've got us working with you, and also for the members who opt into Health ReLeaf, you're getting health benefits, you're getting cost savings, you're getting a personalized program, and you're also getting what comes with that through us to help you better manage and streamline the rest of your operation in your business. So it really is, it's designed to be more holistic than just insurance, but the benefits that do come along with the insurance alone, make it desirable and very impactful.
Yeah,
Oh,
and
yeah.
just to, I guess to just, jump on that, to build something like this in an industry, right, is difficult. We as an organization would not have spent the time and energy to do this without the NCRMA and the approach that they have, the experts that they have, and the support they have of their membership. So, the reason this will work, as opposed to some of the other programs that are out there, is because of, that cohesion between what we're building here on the healthcare side, what's already been built on the other insurance side. And again, the really deep focus on making sure that it's about the risk management. It's about making sure that we protect employers and protect the employees at the same time.
Absolutely. Absolutely. And our mission is to make our members better through education, support, and expertise. And this offering, again, along with all the benefits and the savings, it's also aligned with our backbone, which is education. You're not just signing on and, your health insurance is, rolling, and you're learning about your business, you're learning about your employees, you're learning what improvement takes, what it looks like, what is needed. And so, that power in knowing and learning, you'll have more control over your business, which will give you a greater ability to grow, and grow teams of people who are in it to win it and become assets in that process and beyond. So I want to open up the floor at this time. If anybody has a question that they want to ask Brian or myself about Health ReLeaf, about risk management, let's hear them. You can do it in the chat, or we have a Q&A box as well. Anyone?
We covered everything.
And if there aren't questions, yeah, I think that's a testament to how well we did explaining the program. I'll give you guys another minute. I'll keep chatting. I'll give you a little bit more information here. And if you think of a question between now and the end, we'll of course dive into that. But to learn more about NCRMA, to learn more about Health ReLeaf, visit our website. It's ncrma.net/Health ReLeaf. And ReLeaf is LEAF. You can learn about our health insurance plans. You can, you can get a quote, start a quote, or you can just reach out and ask any questions that you think of after you leave this webinar through there, or you can email Brian directly. His email in the bottom left corner here is brian.mclaughlin@mybenefitadvisor.com. For any questions on the association side, again, one of the necessities to qualify for this amazing benefit is to be an NCRMA company member. So if you are not already a company member and you'd like to explore what the benefits are, what that means, and how to join, please reach out to me directly, jzalkin@ncrma.net, or visit our website, ncrma.net. And also follow us on social media @NCRMA, and visit our website to sign up for our newsletter, which will keep you in the know on all things cannabis risk management across the country. We also do have a LinkedIn group called Mastering Cannabis Risk versus Reward, which is an inclusive group that we built for like-minded cannabis professionals that are on a mission to manage their risk and understand or continue their understanding over the importance of managing risk, a space where we can communicate, ask questions, share information, share resources. And so you can access that via LinkedIn. I want to thank everybody for joining us today, and I especially want to thank Brian for not only being here today, but for spending the last year plus on building this with us, on being a partner, and really giving us the ability to have this end product that we are incredibly proud of and that we know is going to change the industry in terms of how we can offer health insurance and benefits to our teams.
Thank you, Jen. And we did get a question. Someone just asked about what are some of the examples of wellness measures companies can take to save money on our health insurance plan? It's a great question. And again, this comes back to kind of that access to care and making sure people, are getting the most out of the overall program. So, a couple things that we implement quite frequently. So there's a disease management component to the wellness program. So, people that have some health conditions, making sure they're engaging with the program and making sure that they're going through the steps that they need to kind of manage that. And so we have some wellness components around that. A second one is, more of a focus on member engagement with primary care. We've seen really, really dramatic results in long-term cost containment by either incenting, there's always the carrot and the stick, but by incenting people to engage with their primary care physicians, by creating a wellness incentive for people to go to their primary care physician at least once a year, to get their blood work done once a year. We see that, things are caught sooner, first of all, and that when things do happen, even if they're not caught sooner, when there are medical conditions that going on, having that relationship with a primary care drives better long-term results for both the patient. And again, when we can drive better results for the patient, we drive long-term savings for the company. And then, the last thing that one of the other things that we see people are really focusing on now are activity promotion, right? So, if you're an Apple Watch person, right, it's walking a little bit, it's standing, it's, making sure that you have some kind of exercise like built into there, right? Or weight loss programs, right? Like, so how are they things that we can give people access to be able to improve their overall health and well-being outside of a medical condition, outside of a medical setting, right? So access to discount weight loss, access down to discount gyms. So those are some of the things that we can bring to the table. And, year in and year out, we can customize those more and more for each employer. So thank you for that question.
Awesome. We also have another question. The question is, can we expect health insurers to begin considering coverage for medical marijuana as an alternative to pharmaceuticals, some of which can be highly addictive?
So, certainly there's a great debate. I will tell you, I am not the person to give you significant, that is very much more a regulatory issue. Listen, I know that the major carriers are investigating it. I would say like United Healthcare, I know that, they've had discussion around it. They're there. I think until there's recognition at the federal level, that I can't imagine, any of these carriers that cross over state lines making that significant difference. That's just, one man's opinion. I think that's probably the key to, federal recognition is probably a key to a lot of the issues that kind of go on in the industry. But that's kind of where we're at. I do think that, the advantage of programs like this, though, although that's not what you're really trying to do is figure out how to make it here, is that in the long term, those are the kind of things that you could build into your own program, right? As a way to, manage your own personal claims and kind of cost containment. So the advantages of having a more customized approach is that you can build things in like that in the long run.
Yeah. I just want to give everybody one last opportunity to toss a question out there. Otherwise, once again, Brian, thank you. This is just the beginning. It's live now. And we're ready. The Health ReLeaf team is ready. The NCRMA team is ready. We're proud and we're excited to work for you and with you on improving your health insurance benefits for your employees and improving your ability to be sustainable. So once again, you can learn more ncrma.net/health ReLeaf. Thank you. Oh, did you want to say something?
No, just thanks, Jen. Appreciate it. Always a pleasure to talk about the program.
I agree. Awesome. Well, I look forward to all of our members getting to know Brian. He's fantastic. I would say, again, at the end here, you alone are another benefit. You are easy to talk to and you know a lot. And so I look forward to you connecting with our members and us working together to continue building something that is going to be great. So thank you everybody for joining us and have an awesome day. Stay safe out there.
Thanks.
Bye everyone.